This is an 89-year-old female with a dense vitreous hemorrhage of unknown etiology. Since there was a possibility of a retinal detachment, did a lensectomy first, and that's why we have the anterior chamber infusion cannula that we utilized. Here there's some remnants of lens material, and I'm removing that. And as I'm looking at the back of the eye back here, I'm concerned that maybe there's a total retinal detachment that occurred, and we're just looking at bare RPE. But as you can see, as I'm starting to remove this dehemoglobinized blood, that actually it's a layer of vitreous hemorrhage that's adhered to the surface of the retina. And so I start to use a soft tip cannula, start to remove this blood on the surface of the retina. And it's quite tedious to do, but you can start to see that we're actually able to see the retina behind there. At this point, we decide to remove the anterior chamber infusion and remove some of the lens material. And now it looks like we can see that the etiology here of the vitreous hemorrhage was, and it's a macroaneurysm. And it looks like some of the blood is also extended into the fovea here. So now I'm just working to remove all of the vitreous hemorrhage overlying the posterior pole. And you can see that there is some scarring and subretinal fibrosis. Now I'm going to use the finesse loop and to try to get as much of this dehemoglobinized blood off of the surface of the retina, because if I leave a lot of this, most likely as the body reabsorbs it, the patient will have dense vitreous hemorrhage with other issues. Also, since I've done a lensectomy, in order to see what's going on with the patient, any of this dehemoglobinized blood could certainly come on in and cause pressure problems. So now this is why I call it enter the bat cave, because as I remove this with the finesse loop, you can certainly see that there's a lot of this material that is then released. And then as I remove it using the soft tip cannula, it looks like many little bats. At this point, I'm trying to decide how much of this do I remove from the surface of the retina and what would be safe. And I decide that taking it out to about the level of the equator to remove this would be about the right amount to do. And also I'm concerned with, as I'm doing this, that maybe the finesse loop is possibly creating some holes in the retina, or little micro holes. So I'm already thinking I'm going to put silicone oil in the eye. And certainly you can see all this material again kind of just come up, and in my mind as I was doing it, I thought, gosh, these look like bats. So here's an issue. You can see now that there's a retinal detachment, which was my concern. And I've decided that, kind of predetermined that I was going to use silicone oil to go ahead and fill the eye. And the patient is aphakic, so we're going to fill the eye with oil and do a peripheral iridotomy to go ahead and finish the case. Thank you very much.